And welcome back to the WHHI Daily News. Well, May is Women's Health Month, and we're talking about hormonal imbalance in women. I think it's 7 out of every 10 women experience imbalance in their hormones. And with us now from Arizona is internal medicine physician and nutritionist, Dr. Amy Shah. Dr. Shah, welcome to the newscast. We appreciate you taking time to talk about this important topic for women.
Thank you so much for having me.
Okay, so what exactly is hormone imbalance?
Yeah, I know it's a good question. Women's hormones are dynamic. They're changing all through their life. It's changing over the months, over the years. And hormone imbalance is when you may have too little or too much of a hormone circulating in your bloodstream. So it gives you symptoms like fatigue, mood changes, metabolism changes, sleep issues. A lot of women don't even connect it to hormone imbalance.
Well, how do you know if you do have a hormone imbalance? So what are the symptoms, Dr. Shah?
Yeah, symptoms like sleep issues, that's very common. Mood changes, fatigue is like the biggest thing. And often people will have, cramps, worsen PMS. There's a lot of things that are connected, but the fatigue, is probably the biggest one.
And ages. So there's menopause, so there's perimenopause, and then menopause usually in the early 50s. But I have a friend who actually is 80 and she's having hot flashes. So talk about,
Wow.
yes.
Yeah, it's really personal. Yeah, usually perimenopause. Some people start in the late 30s and go all the way to their 50s. And then menopause is when you haven't had a cycle in 12 months. And so that's official menopause. And then there's postmenopause. So there's a lot of different kind of life stages here.
And so kind of back to those symptoms of hot flashes or not being able to sleep well or just not feeling good. What can we do about it? I know there's medicines, there's of course HRT and so forth. So kind of dive into that.
Yeah, the natural things you can do. Diet is number one. So getting a lot of fiber, eating omega-3 fatty acid foods, fruits and vegetables, all of those things. And then you can use supplements to kind of fill in the gaps. I actually, for hormone imbalance, I actually like Metagenics has a Her Wellness line. They have 5 natural science-backed products that have things like activated vitamin B6, saffron. These are things that can really help during that hormone imbalance journey.
Now, what about exercise and not being sedentary?
Exercise and sleep. Those two cannot be forgotten. That's something that women definitely need to do more of, both get more exercise and get more sleep. So both movement and relaxation and recharge are super important.
Do you want to share again, from your viewpoint, your opinion on medicines and HRT?
I think it's a discussion that you have to have with your doctor. Honestly, it's a very personal decision and it shouldn't be based on fears, and you should definitely ask all the questions that you have. I think that the tide is changing and women's health is coming more into the forefront. And so women have more options to choose from, whether it may be medications, supplements, food-based solutions, all of those things. So I think it is different for everybody.
All right, and we have about a minute left. Any other thoughts about sleep and making sure that we're getting, and how many hours should we be getting, like in our 50s, 60s, 70s?
Yeah, so women just don't get enough sleep in general. Women are getting 17 nights out of a month of actual sleep where they feel like they got a full night's sleep. So there's a lot to be said about women and their sleep deficits. One of the biggest things I've learned over the years is that women tend to need more sleep than men. And you might notice that you might be sleeping more than your counterpart. And so they might be able to do 6 hours of sleep, but that might not be enough for women. So I tend to think that women need a little more sleep. The science really just says 11 more minutes that women need. But as we know, women stay up a lot of the other nights. So it tends to be something that, allow yourself to sleep as much as you need to sleep.
Well, very good. Well, thank you, Dr. Amy Shah. Appreciate your great advice and tips today for Women's Health Month. Appreciate it. And that's a wrap for this edition of the WHHI Daily News. Thank you all so much for watching. I'm Robyn Zimmerman. Stay safe and healthy, everyone, and we'll see you next time. Bye-bye.